Are those morning creaks and groans becoming a little too familiar as you move past 60? Or perhaps you find that your joints are making their presence known more often than you'd like. Maybe a dull ache in the knees after a walk or stiffness in your hands. You're certainly not alone. Joint pain is a common companion for many of us as we age, but that doesn't mean we have to simply accept it as an inevitable part of life. What if I told you that your kitchen or a simple, well-chosen supplement might hold some powerful allies in your quest for smoother, more comfortable movement? It's true. Certain nutrients play a crucial role in maintaining joint health and can even help alleviate discomfort. Hi, I'm Dr. Marcus Holliday. In this video, we're going to explore 5 science-backed vitamins that can play a significant role in relieving that nagging joint pain and helping you stay active and vibrant. We'll look at what the research says and how you might consider incorporating these into your daily routine. Let's begin with a vitamin that many of us know for its bone-strengthening properties, but it's also a star player for joint health: vitamin D. Often called the sunshine vitamin, it's crucial not just for bones, but also for muscle function and reducing inflammation, which can be a major contributor to joint pain. Many people, especially as they age or if they live in less sunny climates, don't get enough vitamin D. According to a study published in the International Journal of Molecular Sciences, clinical studies have shown that vitamin D supplementation can reduce pain and improve physical function in OA patients with vitamin D deficiency. So, ensuring you have adequate levels, perhaps through safe sun exposure, fortified foods, or a supplement after consulting your doctor, could be a game changer for your joints. Moving on from the sunshine vitamin, let's turn our attention to another well-known champion in the world of wellness that also has fantastic benefits for your joints: vitamin C. This isn't just for fighting off colds, it's a powerhouse antioxidant and absolutely vital for producing collagen. Why is collagen so important for your joints? Well, it's a major building block of cartilage, that cushiony tissue that protects your bones from rubbing against each other. When cartilage wears down, pain and stiffness can set in. Based on information from the Arthritis Foundation, vitamin C is important for joint health because it is essential for making collagen, a key component of cartilage. It's also a potent antioxidant that helps protect joints from free radical damage. Including plenty of vitamin C-rich foods like citrus fruits, berries, bell peppers, and broccoli in your diet, or considering a supplement if needed, can support your body's natural joint repair and protection mechanisms. We've just touched on 2 incredible vitamins that can make a real difference, and there's more to come to help you build a comprehensive approach to soothing those joints and feeling your best. Now that we've explored the benefits of vitamins D and C for your joints, let's talk about another powerful antioxidant that deserves a spot on our list: vitamin E. Think of vitamin E as a dedicated bodyguard for your cells, including those in your joints. It works tirelessly to neutralize harmful molecules called free radicals, which can cause oxidative stress and damage to tissues, contributing to inflammation and the progression of conditions like osteoarthritis. When your joints are inflamed and feeling the strain, having enough vitamin E on board can really help to calm things down. According to a study published in the journal Nutrients, vitamin E has been shown to possess anti-inflammatory properties by inhibiting the production of pro-inflammatory cytokines and enzymes involved in cartilage degradation, such as metalloproteases. Foods rich in vitamin E include nuts like almonds, seeds such as sunflower seeds, spinach, and broccoli. Incorporating these into your meals or discussing a supplement with your healthcare provider if your intake is low could offer your joints some much-needed protection and relief from inflammatory processes. Following on from the protective qualities of vitamin E, let's consider a vitamin that's perhaps less talked about in the context of joint health, but is nonetheless incredibly important: vitamin K. This vitamin is well known for its role in blood clotting, but its benefits extend significantly to bone and cartilage health. Vitamin K is involved in the carboxylation of certain proteins that are essential for building and maintaining strong bones and healthy cartilage. Some research suggests that inadequate levels of vitamin K might be linked to an increased risk and severity of osteoarthritis because it plays a part in preventing abnormal calcification in cartilage and may also have anti-inflammatory effects. As reported in the Journal of Orthopedic Surgery and Research, a study examining U.S. adults found our study indicates that higher dietary vitamin K intake is associated with a lower prevalence of OA in U.S. adults, particularly knee OA. Leafy green vegetables like kale, spinach, collard greens, and Brussels sprouts are excellent sources of vitamin K1, while vitamin K2 can be found in fermented foods and some animal products. Ensuring you're getting enough of this vital nutrient could be another key piece of the puzzle in supporting your joint health as you age, contributing to their resilience and potentially easing discomfort. We're building a great toolkit here with these nutrients, and there's still one more crucial player to discuss. Now that we've covered the significant roles of vitamins D, C, E, and K in nurturing your joints, let's turn our attention to our fifth and final group of valuable nutrients, the B vitamins, with a special nod to B12. While the B-complex family is known for a wide array of functions, including energy production and nerve health, several B vitamins also exhibit anti-inflammatory and analgesic, pain-relieving properties that can be incredibly beneficial for those experiencing joint discomfort. Think of them as soothing agents that can help calm irritated tissues and potentially reduce the pain signals your body sends. When your joints are feeling inflamed or sensitive, B vitamins can contribute to an overall sense of relief. According to a review published in the Journal of Clinical Medicine focusing on knee osteoarthritis, B vitamins, including thiamine, riboflavin, niacinamide, pyridoxine, pantothenic acid, biotin, folic acid, and cobalamin have anti-inflammatory and analgesic properties. Foods rich in various B vitamins include whole grains, lean meats, eggs, legumes, and dark leafy greens. Ensuring a good intake of these, and specifically considering B12 if you follow a plant-based diet or have absorption concerns, always best discussed with your doctor, adds another layer of support for your joint comfort and overall well-being. So, as we've seen, taking a closer look at what's on your plate or in your supplement cabinet can truly make a difference when it comes to managing joint pain after 60. From vitamin D helping to reduce inflammation and support muscle function, to vitamin C being crucial for collagen production and cartilage health, and vitamin E acting as a powerful antioxidant protector, these nutrients are key. Then there's vitamin K, playing its part in bone and cartilage integrity and potentially preventing problematic calcification. And finally, the B vitamins, including B12, offering their anti-inflammatory and pain-soothing benefits. It's about creating a supportive internal environment where your joints have the building blocks and protectors they need. Remember, it's often the consistent, small changes that accumulate to make a big difference in your health and happiness. You have the power to make choices that nourish your body and support your active life. We hope this exploration into these 5 science-backed vitamins has given you some valuable insights and practical ideas. We'd love to hear from you. Have you found certain vitamins or dietary changes helpful for your joint health? Please share your thoughts or experiences in the comments below. Your journey could inspire someone else. If you found this information helpful, please give this video a thumbs up and consider subscribing for more content designed to help you live your healthiest, most vibrant life. Wishing you many more years of comfortable movement, energy, and joy at any age.